there, and welcome to tonight's live streamed webinar. Thank you for joining us. My name is Zoe Clark. I'm Programme Manager here at NASS, and I'm delighted tonight to be joined by Amy and Mel, and we're going to be chatting all about a new programme that NASS are developing. Hi Amy, hi Mel, thanks for joining.
Hi.
Hi.
Yep. Brilliant. So I can see people are joining us live already, so that's fantastic. If you are joining us live, please do say hi in the comments. Let us know where you're joining from. And this is a nice interactive session. So if you'd like to ask us any questions or share your experiences, please do pop that in the comments, and we'll keep an eye as we go along and answer any of those questions towards the end as well. So before I do a bit of an intro to the session, do you want to both introduce yourselves? Perhaps Mel, want to introduce yourself first?
Sure. So I'm Melanie McInnes, and I was diagnosed with AS around 4 years ago, but had symptoms since my late teens. So as is typical with a lot of stories from persons with AS, it took quite a long time to receive a diagnosis. So I'm glad to be here and being able to support NASS in the brilliant work that they're doing.
Brilliant, thank you.
So I'm Amy Cole. I've had AS for about 9 years. My symptoms started when I was in my final year of university. I started off with the typical low back pain that was worse kind of in the night and with a lack of movement. And then I developed lots of the rest of the symptoms like foot pain and fatigue and brain fog. And yeah, AS, NASS is a fantastic charity that has given me a lot of support over the years. So it's good to be here.
That's brilliant. Thank you both. And yeah, we'll be chatting a little bit more once I've done a bit of an intro into the topic. And it'd be great to hear from you both kind of what you've been involved with in NASS and how everybody watching can get involved as well. So again, welcome to everyone joining. I can see Craig, Caroline and Andy in the comments. Hi, thanks for joining us. And hi to anyone who's watching on catch up as well, because if you can't join the whole session live, then please do come back to our Facebook page or our YouTube page afterwards. You'll be able to pick up on the recording then as well. So if you aren't able to join the whole session live, then pop any questions in there. We'll make sure we cover those at the end and you can come back and catch up afterwards. So before we get into our chat, I'll just explain a little bit about the gold standard project that we're going to be talking about and what we mean by gold standard. So NASS is currently developing a gold standard in treatment and care for people living with axial SpA. And this is really important because there are sort of national and international guidelines and quality standards that already exist, but there are some limitations and quite a lot of them are much more clinical based rather than having a lot of input from people living with the condition. So really our aim is to create these guidelines and also tools to support clinicians in implementing the guidelines that really do balance both the clinical considerations that a lot of the guidelines already cover, but also importantly the lived experience, hence why Amy and Mel are chatting with me this evening. So it's really important to us that this is achievable. So it's really achievable, particularly in the context we know that NHS services are really stretched at the moment, but also it should be aspirational as well. So it really should help give services a standard that they can measure against, they can make sure that they're meeting the right standard. And also for people living with the condition, it will give them something really tangible to go to and give them a clear picture of what they should be expecting from their treatment and from their care for their condition as well. So we do hope that over time, through developing these standards, that this gold standard will become the go-to guidelines for all services in the NHS that see people for axial SpA, and essentially improving the treatment and care for people living with the condition as well, so that everyone with the condition receives consistently excellent care. So that is our big hope and our big aim, but we really are appealing to everyone who's watching tonight and anybody who's catching up on getting involved as well to really help, particularly at this initial stage as well. So I think it would be great to kick off chatting a little bit about what I've mentioned in terms of the fact that we're capturing the experiences of people living with the condition, so that we really make sure that the guidelines are really representing the needs of people with axial SpA. So Amy and Mel are both members of our steering committee because we have healthcare professionals and people with lived experience on the committee. So it'd be great if you both just tell us a little bit about why you got involved in the project. And Amy, if you want to go first.
So over the years, I've had a lot of help from NASS, both on the helpline particularly from Gary, who's been a great help to me. I joined my local NASS branch about March last year and go to hydrotherapy there, and that is super beneficial, not just the physical exercise, but it is really beneficial to be able to talk to people that also have AS, because I don't think anyone can quite understand what life with AS is like unless they've experienced it. So yeah, that's really beneficial, and I wanted to take the time to try and give something back. And this project particularly interests me because it has the potential to help everyone with SpA. And from my personal experience of kind of being diagnosed and treated, your level of care at the moment kind of depends quite a lot on your ability to advocate for yourself. I mean, I over the years have got quite good at that, but I'm aware that not everyone has kind of the same level of care provided. So in the gold standard, hopefully, we'll be able to improve the situation so everyone can get a good standard of care.
That's brilliant, thank you. And Mel as well.
Yeah, so very similar to Amy, the NASS resources and support have been a great help during that long process of being diagnosed and beginning to understand more about AS. So I've been, drawing upon some of that information on the website, joining live sessions such as this one, and it's really been brilliant just learning about the work of NASS and listening to like-minded others that have been, that are living with AS and learning how to manage life with AS. I also, as a health services researcher, have a professional interest in improving pathways to care, shared care between primary and secondary care, and improving some diagnostic times. And I really wanted to draw upon both my professional experience and my lived experience of AS to try and give something back and help others with AS and those waiting for a diagnosis.
That's brilliant and so valuable as well, getting that mixture of experience in there. So thank you both, for being part of the steering committee as well. And I think we've got some of the steering committee joining us live as well. So thank you to everyone involved. It's a really exciting project to work on with everyone too. So I think it would be great to hear a little bit more about the work that's been done so far, because although it's kind of, we've not been speaking publicly about it for very long, but obviously there's a lot of background work and hard work that's gone into it so far. So Amy, if you wouldn't mind just telling us a little bit about kind of what we've covered so far.
So there's been 12 months work gone in so far. And as Zoe said, that it's a committee made up of people with lived experience and healthcare professionals working with people with SpA. So what the group's done is met to decide the areas of care and treatment that should be covered in this programme. So it was decided that there will be 5 separate work streams. These are how you receive your care, medication, therapies, how SpA affects you in other ways, and living with Axial SpA. So each work stream has a separate kind of little group working on it, and that's led by one person with lived experience and a healthcare professional. So the work so far that's been done is kind of reviewing the evidence and the guidelines that are already in place for each of our work streams. And also we've started to compile research on these particular areas to look at what's kind of evidence is already available for us to look at. So the stage that we're at now, and while we're asking people for their experiences, we want evidence from people and their experiences to learn what kind of things they've had that's worked well and helped with their disease and diagnosis and treatment.
That's brilliant, and shows the amount of work that's already gone into it and what a big project it is as well, isn't it? Rather than, it's not just looking at medication, which there's a lot of guidelines out there already on that. It's looking at really like the whole of your life with Axial SpA, which I think is incredibly important. That's brilliant, thank you. And Mel, do you want to tell us a little bit about kind of the next steps that we're taking with the project?
Sure. So we're currently collecting experiences and evidence, and we'll review this to start to establish what the gold standard is across the full patient journey after diagnosis. So towards the end of the year, we'll share this with people with lived experience and healthcare professionals to get their views on if we've got it right. And our hope really is that the gold standard will help to improve services for everyone with axial SpA, and at the same time help clinicians to be able to deliver the best that they can. And we hope also, without adding pressure, we actually hope to relieve some of that pressure on the clinicians through this process of establishing the gold standard.
That's fantastic. So I think, it's really easy when we're talking about a gold standard. It sounds really kind of unachievable. It sounds like, we know that things are already very stretched as well. So it's really good to hear that, that's going to be a focus as well.
Yeah.
That's brilliant. And I've popped a link up there. So if anybody's interested in getting involved, you can head to the website to learn a little bit more about how you can submit your experiences. So, as mentioned, it would be really good just to kind of understand what we're looking for with the evidence that we're asking people to submit. People may have seen on social media and through our emails already about it, but it'll be great to tell them a little bit more. So Amy, if you'd like to tell us a bit more about that, would be great.
So we want to have examples of good care that you have received, whether that's within rheumatology clinics themselves or other areas of care, such as physio, or if you go to related clinics like gastroenterology. So we want to know what's worked well for you and why it's worked well for you. As one kind of personal example, I like, it's called patient-initiated follow-up. So when I have a physio appointment, you get referred for your physio, have your sessions, but then once the sessions are finished, you have 6 months to be able to ring up and get an appointment to go again if you need more sessions. And I find that really helpful because even if I don't end up needing those sessions, it's nice to know you can easily get an appointment. So that's something I'm going to be giving evidence on that I like as a standard of care. It doesn't just have to be things that you've experienced in the NHS. I'm about to start a joint pain program, a local gym that is designed for people with joint pain to kind of build up how much exercise you do. And then it's also got kind of sessions on fatigue management and nutrition and things like that. So I've not started that yet, but I think if that turns out to be a really good experience, I'm going to submit evidence as well, because we want evidence from a whole range of things from all aspects of the disease. So yeah, if you've had something that's helped dealing with AS, then it's good to submit it as evidence.
That sounds fantastic. And Mel, have you found something similar or anything in particular you're interested in submitting?
So similar to Amy, I have had that great experience of the peer review in physio, so the being able to follow up within a 6-month period. But I'd also say to people that think about any examples that you have from primary care settings. So are there people within your GP practice that have been particularly helpful? So your GP, a nurse practitioner, the practice physio. I think it'd be really helpful for us to hear about those experiences as well. And that's an area in which I think there can be a lot of improvements made in terms of managing AS out with the specialist care within the hospital, and really will help to establish, the kinds of things that GPs and practice staff need to do to really support patients with AS.
Yeah, that sounds brilliant. And yeah, as we mentioned earlier, it's kind of looking at that whole pathway, isn't it? And kind of all round treatment and care, not just that looking at medication and looking at quite narrowly like that. So that's brilliant. And obviously you're both experts with lived experience, and we have people with lived experience involved in the steering committee, and also hoping to get that evidence from people as well. So it'd be great to share a little bit more about why this lived experience is so important to the project. Amy, if you want to go first.
I think as patients with that SpA, we're kind of experts in the whole experience. So we know what it's like to go through that really long process of getting diagnosed, know what it's like to experience kind of finding the right medication and treatments that work, and we have an overview of all of it. So it's really important that we get the views of the healthcare professionals who are experts on their little section of whatever they're doing, but we we need the people who've experienced what it's like as a patient, and what they've found to be helpful. Yeah.
Absolutely. Anything you'd want to add to that, Mel?
Really just to reiterate that, drawing upon first-hand experiences of living with AS is really invaluable for projects like this. So, I mean, for me, I think it really provides better insight into the challenges and the needs of persons with AS. It also keeps the project relevant, it keeps it realistic, and it aligns with that more person-centered care approach that the NHS is striving to work towards. And I believe it'll actually really help to instill a high degree of trust in the work of NASS and in the implementation of the gold standard within the NHS. And that's because the work's going to be underpinned by the experiences of, persons with lived experience. And this is something that's been shared amongst those affected with AS. So patients, their families, and the healthcare professionals. So it just gives that a really holistic picture of what's actually going on and where we're going.
Yeah, absolutely. And I think it's really good that you touched on as well, friends and family and carers of people with the condition as well. Everyone involved in the lives of people with Axial SpA is welcome to submit evidence to help us build up this gold standards. That's great. And I can see in the comments we've got people joining from right across the UK, but we've also got Gisli joining from Iceland as well. So hi, thank you for joining us. And we've had an email before the session from someone who's experienced care in France and then moved back to the UK. So although the guidance is going to be, focused UK based and a lot of NHS based as well as private practice, it will be great to hear from people who have lived in other countries. And please do feel free to share in the comments kind of examples of good care that you've had, because that's all would be really helpful for us to hear and be able to draw upon as well. And so we've sort of touched on a little bit about the fact that it's really important to get information from healthcare professionals as well, and we are encouraging patients to ask their healthcare professionals to get involved, but we are really mindful that the time in appointments is quite small and it's really, really valuable, so we don't want to take up too much time in appointments asking people to pass on this info. So it would be great if you shared if there are any kind of quick and simple things that people can do to get their healthcare professionals involved in this. Mel, is there anything you'd suggest?
So, for example, I actually took along one of the posters for the call for evidence. I took that along to one of my physiotherapy appointments and explained that NASS are looking for examples of good care from persons affected by axial SpA and from healthcare professionals that have been supporting them. It really only took a couple of minutes out of my appointment time, and the response was really positive. They were really happy to display the poster in the department. And at my next appointment, I'll definitely be encouraging them to contribute to the submissions and share with their colleagues what NASS have set out to achieve.
Oh, that's really great to hear. And if anybody's watching and would like a poster to share with their healthcare professional, do let us know. You can email my colleague Jill at jill@nass.co.uk. I'll pop her email address in the comments after the live as well, so you've got that, but it's just jill@nass.co.uk. It'll be great to be able to give those posters out to get patients involved and also then ask healthcare professionals to share with colleagues as well. It'll be brilliant. And I can see a few comments coming in as well. So, that's great to hear, Georgie. Getting bloods done on Friday, so just going to take some printouts. Thank you. So it was really interesting in our last meeting with the steering group as well. So Patricia, one of the healthcare professionals who's involved in the project, she shared how healthcare professionals she feels would be really delighted to hear from patients that an aspect of their care has been submitted as evidence to gold standard. It's a really big compliment, so they'd be really happy with that. And we did mention a little bit that kind of the term we're using, gold standard, could potentially be a little bit intimidating. So it might be helpful if you could share some practical examples of the things that have been submitted so far, just to give people a bit of an idea that it's not necessarily something really big. It could be something smaller that is an example of a gold standard. So Mel, do you want to go first?
Sure. So we've had quite a few submissions come in talking about the care that they've received across disciplines. So, for example, people who have both axial SpA and uveitis have really benefited from the health professionals they see in rheumatology and ophthalmology holding a joint clinic. And this allows them to discuss how they can best manage that group of people and what medications they should be prescribed.
That sounds brilliant. And how about you, Amy? Any examples you'd give?
So outside the NHS, people have submitted evidence on finding local support groups that are really beneficial, such as local NASS branches. People have been talking about the benefits of hydrotherapy. And we've also had people saying how they find kind of having access to up-to-date, reliable information is really important to them through things like the NASS website and the booklets that are available in most NHS rheumatology clinics.
Oh, brilliant. And that's always good to hear. Good to hear that we're doing the right sort of things. So that's brilliant. It's really good to understand those more kind of practical things that we're asking people to submit. And so I'll share the link again in the comments afterwards where people can learn a little bit more about how you can actually submit that evidence and those examples as well. And I think it's good to mention at this point, particularly for any healthcare professionals who are watching as well, we're really keen to hear from everyone, whether you're working in private practice or NHS, and particularly if you're not necessarily in kind of a big rheumatology department with lots of different healthcare professionals, but also really keen to hear from people who work with, just on your own or with one or two other healthcare professionals, those smaller departments, so we can really understand kind of how this gold standard is going to be possible to implement for everyone, no matter what your provision is locally as well. Because we know that services can be really struggling with the pressures at the moment. So it's really important for us to really kind of understand how we can work with people and make it achievable too. And really important to say, even within the pressures, there will still be lots of examples of good care and good ways of working that we're able to share as well. So it'd be great to hear as much information as we can that's all going to go into the project. So please, if anybody is watching and wants to ask a question of us, please do pop that in the questions because we'll come to those shortly. But I think it'd be great before we do that, just to hear kind of final thoughts from you both on kind of really what you're hoping to achieve with this project. I know we've touched on that a bit before, but it'd be good to end on that. So Amy, go ahead.
So I hope that we manage to achieve a framework of care that means kind of wherever you live, whatever your medical literacy is or your understanding of SpA, that everyone gets the same access to care and levels of care and things available to them that are the same no matter where you live. And I think it's really important that we need to start treating the disease treating all of it, the fatigue, the kind of aspects of how it affects your mental health or kind of your employment kind of things. At the moment it feels kind of we're treating the joint pain, but there's so many other things. So it'd be really good to create a framework that means all of it. We get support for all of it, really.
Absolutely, couldn't agree more. And how about you, Mel?
Yeah, I mean, I agree with everything that Amy has said there. Establishing a framework that can underpin equitable and holistic care for patients and pathways to timely diagnosis. But more than that, I hope that we're able to offer guidance for healthcare professionals in both primary and secondary care contexts so that they can develop a better understanding of axial SpA and the needs of patients.
That's brilliant. And yeah, I'm really excited to see the project continue as well. So thank you both again for not only joining me this evening to chat about it, but also being on that steering committee as well. And thank you to all of the healthcare professionals and people with lived experience and all the experts on the committee. I'm only sort of working on the fringes of the project, so I'm allowed to say that it's a really exciting, fantastic project. And thank you to my colleague Jill as well for leading on it, just doing a fantastic job. So great. I think what I'll do is I'll go to the questions. So if we've got any questions from the audience, please do pop those in the comments now. I'll take a look at what we've got coming in. So Jacqueline's shared, I'd also love if cardiovascular repercussions are included, lungs and heart. It isn't discussed as much. Absolutely. So that is going to be included in one of the work streams. Amy and Mel, I don't know if either of you want to expand on that. I can't quite remember which work streams you're involved in. So feel free to.
I think it might be extra axial care. It is definitely written down somewhere, I'm certain of it.
Yeah, it's definitely in there. And if you want to submit anything on your experiences, that would be fantastic, because it's definitely an area that we've got a little bit less info on and a little bit less research on. So your lived experience would also be really helpful. So it'll be great if you could send us over any info or get in touch for a chat, please, Jacqueline. Let's have a look. And yeah, Jeff has asked, our carers are expert by experience too. So could they be included in the gold standard? Absolutely. Yep. Please do share the call for evidence with absolutely everyone, friends, family. It'll be fantastic to hear from them. And we've got as well, so oh, that's fantastic. Caroline's shared a little bit about the evidence that she's going to submit. So she's got an appointment with her rheumatologist next week, and looking forward to praising her and treating me as a whole patient in relation to my inflammatory bowel disease, fatigue, mental health, etc. So I'm going to encourage her to submit evidence on her approach to treating patients as an example for others. That's lovely to hear, and I imagine your rheumatologist will be over the moon to hear that as well. Yep, and we've got Jill. Thank you for adding in the comments there. Jill's confirmed cardiovascular and lung health is in the extra-axial care as well. So Amy was right on that one. Thank you. Wonderful. So I think that's all the questions. Oh, we've got one more asking, will NASS be lobbying the new government to ensure Axial SpA initiatives receive funding in the future? Should there be delivery on the promises of splashing cash to the NHS? That is probably a question for my colleague Jill, I would say. I know Jill leads our work on sort of policy and campaigning as well. So what I'll do is I'll let Jill comment directly back on that. And then so if you come back and have a look, she'll be able to expand on that. But yeah, I imagine she's hard at work already. Brilliant. So Georgie's asked, are there any areas that you're lacking evidence for, or is it too early to know? I don't know if either of you wanted to answer that.
It's probably a bit early to know just yet, but that's certainly something that we could maybe highlight as more evidence comes in. It might be a good idea for us just to kind of post the areas where we're missing a bit more of the evidence.
That would be great, definitely.
Yeah. It's a great point.
Definitely. I'm just going to check as well. Also, we've got a comment over on Instagram. Sally's asked, when will the new standards be available? So it's going to be, so I think the draft is looking at kind of summer next year, I think. Amy and Mel, I don't know if you've got up to date on that.
I'm not sure of the answer to that. Mel, do you know?
I'm afraid I don't, but if we're reviewing evidence over the next few months and hoping to pull all that information together by the end of the year, I think next summer sounds like a reasonable time frame for us to be able to do that.
Yeah, that's great. And Jill's confirmed in the comments as well. So I'm glad we were correct on that. Yeah, so the first draft next summer, and then there'll be lots of time for people to be able to give feedback on that as well. So then we can make sure that we're continuing to develop them with the right feedback too as well. And Jill has also confirmed as well that plans are in place for a possible lobbying event in the autumn. So watch this space. Hopefully we'll be able to do that. Great, we've got lots of comments and questions coming in. That's fantastic as well. So Caroline's shared, just going to submit evidence on her hospital's occupational health fatigue management program, as I think it's an area of huge unmet need for many other patients. That sounds fantastic. I don't know if Amy and Mel, you've got any thoughts on that?
I would agree on the opinion that fatigue management is kind of a little bit forgotten. That's what I found personally. So yeah, if there's any programs in place that are targeting fatigue, that would be really good to hear about. That'd
be brilliant. So yeah, more info on fatigue, the better. Personally, for me, it's one of the trickiest things to manage, I find as well.
Yeah.
Fantastic. Let's have a look. So Jeff has shared, I like the idea of relieving pressure on professionals, and maybe we could come up with practical things to reduce the workload of professionals. for example, a simple way to include carers in correspondence from professionals. That would be fantastic. And yeah, if you've got any practical examples like that, it would be great to hear those. Gosh, we've got so many questions and comments coming in. I'm trying to keep track and make sure I don't miss anyone. And yeah, Debbie's shared, it would be great to have evidence for those services who are struggling to show the powers that be how their services should be run. So that would be really great. It's another way of people sort of being able to get the support that they need for running their services too. Let's see, I think we've covered all the questions so far. While I'm just catching up on that, Amy and Mel, is there anything that you wanted to add that we've not covered or anything?
I'm not sure there's anything we haven't covered, but I think this is everyone's opportunity to kind of have their say, and it's an opportunity to improve everyone with SpA's level of care. So yeah, we need your evidence to be able to do this. So if you could take the time to submit some evidence, it would be really, really appreciated.
Yeah, same for me. It's great seeing these comments come in, and there's some really nice examples there. So please draw upon your experiences and submit some evidence or examples of, you know, what you think has been great care and how to improve our services.
Yeah, absolutely. There's already like so much evidence just in the comments. So yeah, please do go to that web address that I popped up on the screen and take some time just to share with us through the consultations, so we make sure that all of that's included. And Jeff's asked in particular in terms of therapies that there's so much that we find helps, but it's not backed up best by lots of research. So as experts by experience, with lived experience, we can say that something works. So can this be included? And Jeff, absolutely, yes, please. This is exactly the kind of gold that we're looking for, to make sure that we're capturing that. So it's not just based on that kind of clinical guidelines, the clinical research. We've got lots of out there. We want to have all of those kind of real life experiences of all the different things that can be helpful. So please do, pop all the info in on that webpage there. And yeah, I think the final comment Hayes has shared, they find that there's a lack of joint care from different departments dealing with individual symptoms, often discharged quickly by each. So if you've got any experiences of, you know, how that could be improved, or if anybody has any examples of where that's been really good, then please do, submit that so we can make sure that we're including it and showing why it's important as well. Wonderful. So I think we've covered everything. Amy and Mel, have we missed anything? Any final thoughts?
No, I think we've covered a lot of the key topics that we needed to today. But I would just say again, please submit your evidence. We really need it.
Yeah, we can't do it without your evidence. So
yeah,
absolutely. So thank you both again so much for joining me this evening, for sharing. It's been fantastic to really kind of bring the project to life and hopefully encourage lots of people to submit their evidence and get involved in helping us with this quite mammoth project, but as we've shared, really incredibly important one as well. And hopefully it is something that is going to be able to really change the lives of people with axial SpA, you know, for the years going forward as well as supporting our healthcare professionals, health services, and all the different therapies and everyone involved in people living with axial SpA essentially. So thank you both again. I'm going to pop up on the screen as well when our next live stream is going to be. So on next Wednesday, so 24th of July, 6 p.m. again, I'm going to be joined by researcher Dr. Matt Roberts, and we're going to be talking about his research on walking with axial SpA. He's going to be sharing the key findings from his recent research, which are really interesting. So looking forward to that. So wonderful. Thank you both again so much for joining me. And thank you everybody for joining us live. It's been fantastic to hear your experiences and see your comments as well. And if anybody's joining us on catch up, please do continue popping any questions or comments in there, and I'll keep an eye on those over the next few days too. But you can always email us. My email address is zoe@nass.co.uk, or my colleague Jill is jill@nass.co.uk. And hopefully be chatting to lots of you getting involved in the gold standard. So thanks again, and see you all next week, and see you soon, Amy and Mel, in our next meeting.
Bye.
Thank you.
Take care. Bye.